Hello, good evening, good afternoon, good morning, everyone. Thank you so much for coming today. I see good numbers that we have 61% in the Zoom right now. Greetings from Indonesia. It's evening for now. And yeah, before we start, just want to introduce myself. My name is Fitria, or you can call me 50. I'm one of the co-coordinators for this Road to Busan Plastic Action webinar series that will be your host in 1 hour 45 minutes. And we will be having a good discussion today with amazing speakers that are already in the room as well. So, yeah, thank you so much for coming and participating in the webinar. And please feel free to use the virtual background that I have put in the chat box, and also introduce yourself. Just tell us where you're coming from, and then yeah, just try to use it as for to get connected with other youth from worldwide. And yep, uh, please also I want to remind a bit about the house rule. If you're not speaking, kindly please keep your mic muted. And if there's any concern, you can try to raise in the chat box. And yeah, to to allow a conducive environment. All right, so I'm just gonna start for giving a quick overview. So everyone, thank you so much again for coming to the Road to Busan Plastic Action webinar series. So basically, this webinar, we have co-conveners, children and youth major group to UNEP or CYMG, and also International Pollutants Elimination Network, IPEN. And also we have Global Center for Good Governance in Tobacco Control, GGTC, and also Healthcare with the Harm. These conveners help to build the first webinar series of the Road to Busan Plastic Action webinar. And for your information, this Road to Busan Plastic Action webinar series is developed to give awareness and understanding of the Intergovernmental Non-Negotiating Committee or INC process, which will discuss about the international legally binding instrument on plastic treaty, and the fifth meeting, which will be happening soon in Busan. That's why we have Busan as our title in this webinar. And yep, in this webinar, the first webinar series, we will talk about the health and how we delve into the critical issues of the plastic pollution and its severe impact on the health of vulnerable groups, especially children, women, and informal workers, as we mentioned in our title, and also how to address the full cycle of the plastic itself. And yeah, as the world moves to the finalizing the international legally binding of the plastic instruments, it is essential for us to integrate the health perspective into the effort itself. And yep, we have these two channels for interpretations, everyone. You can try to see on your right. I think you can try to find the interpretation function for you to switch to Spanish or to French. So it will be easier for you to engage if you are not really fluent in English, but you have your mother tongue in Spanish or French. So we provide this facilitation to help gain more network and more people to watch our webinar later. And for your information, we will be also sharing this video of the webinar into our YouTube channel. So if you're not consent of your picture, or you can just turn off your camera, and yeah, and feel free to again introduce yourself or making connections in the chat box, while also keep yourself muted during the presentations. And we have today 7 outstanding speakers that will talk about the plastic pollution's impact on the health for the vulnerable groups that we mentioned in the webinar: children, women, and the waste workers. And from this discussion, we hope not only to raise the awareness and knowledge, and also provide an avenue for everyone to understand the process of the health impact of the plastics or the INC process as well. But we also want to make this webinar not only the health webinars, but the more upcoming webinars that will be happening in few months, in CYMG as part of as the tool for our advocacy activities to integrate what we have gained as the key lessons from the webinars to be integrated into our policy brief that we will bring later to the INC meeting in Busan, which will have been following the processes since the very beginning. So it's important for us to also not only preparing within our constituency, but also gaining the key lessons from all of the speakers here and also the discussions to help shape the policy brief that will determine the position of the youth, requiring the urgency to interrogate the health and the other aspects to the plastic treaty. All right, so without further ado, I think I will jump into the next session, which there will be a keynote speech from our esteemed speaker. Here we have Dr. Mega Rati. So Dr. Mega is the Technical Officer, Climate Change and Health Unit, Environment, Climate Change and Health Department in World Health Organizations. So Dr. Mega has over 2 decades of experience integrating the environmental and sustainability within the health sector. She is the part of the Climate Change and Health Unit Department of Environment, Climate Change and Health in WHO, and the technical focal point for environmental safeguards for the organizations. Dr. Mega also has vast experience of working on a range of environmental sustainability issues within the health sector, such as environmental due diligence, healthcare waste management, sustainable procurement, and chemicals of concerns, including plastics. Before joining WHO, Dr. Mega has also worked with various international agencies such as UNEP, World Bank, and civil societies in India and also globally. So I will give the floor to Dr. Mega. Dr. Mega, the floor is yours.
Yeah, hi. Can you hear me well?
Yes, I can hear you.
Can I request you to advance my slides?
Yes.
Yeah, thanks. So thank you so much. I'm really honored to be a part of this youth dialogue is on health and plastics. Actually, I would just say, the first time I met your youth delegation, this was in the INC4, and then I met them at the World Health Assembly that we had in Geneva. It was such a strong statement coming from the youth delegation on plastics in the health sector overall and the health risks that are linked to plastics, So I think we owe a lot to the youth. And there's a strong voice that's coming from the youth, and hats off to you. All of you here, you really have got the issue elevated, which is so important for the rest of us to really consider and act now. So, and as just, the slide says, so WHO has been a part of the, has participated as observer through the INC process. It provides advice to the member states on the health and environmental risks that are linked to the plastic production, use and disposal there. So can I move to the next slide? Yeah. So just here, I'll just take a step back. It's about, just not plastics. When we talk about overall, I'm just telling you the health sector per se. When we talk about the health sector, few of us might already be knowing that the health sector contributes to about 5% of global greenhouse gas emissions, which if it was a country would have been the 5th largest emitter. So there's a huge footprint that the health sector has itself. Now, at the same time, when we are providing quality of care, health care, we are, at fault as well that, we're creating this greenhouse gas. So we have to act now. And then we have seen that there are these different, there's a lot of political ambition that's risen over the years. And just to highlight a couple of them there, we see that the UNFCCC process, the Conference of Parties 26, 27, and 28, actually, it was the Conference of Party 26, wherein the first time there was a health initiative that happened. There was a health dialogue and decided that health really needs to get a center stage in all of these conversations that we have around environment. And I think we should take that message as a strong message, that it should not take 26 COPs to really get health into the center stage of any environmental negotiations or treaties that we're having. and for that matters, definitely the plastics, the instrument that we are currently talking about on plastic pollution and including the marine environment. And just there's out of the COP26, we came up with ATTACH, which is called the Alliance for Transformative Action, Climate and Health, which has 82 member states or countries as part of it who have committed to have strengthened health resilience to climate risk, and at the same time building climate resilient, environmentally sustainable, low carbon health systems, which include supply chain and also, reducing single use in plastics in there. The others, just to highlight, are also the Global Framework of Chemicals, which directly links to the Plastics Treaty again. And definitely the work and the role that we have here in the negotiations with the INC process and the way to go sound that's there. The other thing that I wanted to highlight that you see on the left is within WHO also, we have elevated the mandate of climate and environment. So we have a global program of work, this is what really guides WHO's work as we move forward. So this is a 14th global program of work, which starts in about a couple of months. This is the very first time that we have a standalone indicator on climate change and health, which means that the work WHO would do has to align on certain indicators that we have on climate mitigation and climate resilience. Also including, as I said, the work on mitigation will include reducing single-use plastics and other plastics that we're using in there. We've had 2 resolutions, which is a member state mandate for WHO to help member states work on. And the 2023, the resolution that was 7617 is on impact of climate, impact of chemicals, waste, and pollution on human health. And the other one is that just passed on this May in 2024 is on climate change and health. So there's a strong political mandate that we have coming from our member states for WHO and as well as the member states to act on. I just wanted to highlight that here. Can you go to the next slide? Yes, this is something that we all know, that plastics are used extensively in the health sector. Very often they are overused in the health sector. We know they are important because of the sterility aspects that are there. But very often we see, there's a lot of overuse that's there. So that's somewhere the health sector really needs to act upon. We cannot just leave it to anybody else. There are many areas where health sector can intervene. Some of the examples that are very prevalent in some pictures here are the overuse of personal protective equipment that happened during COVID-19. WHO came up with a study which showed that more than 50, around, not more than, but around 50% of the personal protective equipments that were procured were not even utilized. So we really have to think about, what is really needed for the health sector, how much can be used, how much can be. So we have to look at the principles of waste, minimizing where possible, reuse, recycle. So this is something that the health sector really needs to consider, and that not only is good for the environment, but as I said, it also reduces the health risk that's, linked to all the production, use and disposal of plastics. And the pictures you see here, so very often we find that the plastics that are used in the health sector are non-clinical. They're not the essential plastics, but a lot non-clinical plastics that are used, which have the potential to be substituted. Can we go to the next slide? Yeah. So here again, as I said, that we have to understand that plastic is a beast in the room here. It's huge. It has a huge impact. But then, as I said, WHO has a mandate. And just highlighting, some of the key aspects that came out of the WHO resolution last year. As I've already highlighted, the member states expressed the concern about the production, consumption, and disposal of plastics products, including microplastics and related chemicals of concern that are released into the environment. They have potential health hazards. So this has been highlighted in the World Health Assembly resolution by the member states, which gives us a mandate to work on these issues and to minimize the risks, the environmental and health risks that are linked to this. and also to scale up WHO's work around plastics and health. I think we have a mandate here, and we have a convening power as WHO to strengthen the language on public health aspects within the treaty. And of course, to continue providing technical support to the countries, increase capacity building, use different tools and resources that are there, like the science-based initiatives, talking about the health impacts of microplastics. So this is something that's an ongoing effort from WHO. Next slide. Yeah. So I'm just conscious of time. I think so the key guiding principles of WHO's position in the new plastics treaty, we definitely know it's really important to pursue the highest attainable standard of human and environmental health. This has to be a core objective of the treaty. Right now, we see the treaty language is getting better, but still that emphasis is not there. We do talk about environment, but the emphasis on the health aspects of the health risk is not there, which really needs to go hand in hand with the environmental risk that there. We need to address the potential health risk from the production. It's not only the end disposal or the waste management. It actually starts from the whole life cycle approach that we're looking at. And something that we do not have to really forget, it's really ensuring the quality of care that the health sector has, So we have to ensure safe and effective health products that are good quality and are affordable, accessible, and appropriate. So to keep that in mind and still work around that treaty language there. Yeah, the next slide, please. So the key elements that, as WHO, we have provided a statement in the INC 3 and 4. I'll just highlight some of the key language that went into our statement. We see definitely, as I said, to highlight the recognizing health risk linked to sustainable development. And the other point that's important is there was a language that said blanket exemption to medical use of plastics. I think that is something that WHO does not support. We think as I said, it's important to keep the quality of care. The products are really important, but at the same time, we need to understand innovation is important. There are areas where the health sector can innovate and reduce the amount of plastics that are used there, and no blanket exemption. And maybe a sectoral approach where health sector is given a special, sectoral approach, and we work very closely with the various stakeholders on different aspects, including procurement and waste management, and leveraging WHO's expertise. I think I already highlighted some of it in the last slide, but just to re-emphasize that WHO offers establishing guidelines and technical standards that are really important, and which can be shared with the member states to strengthen the language on the treaty text. And I know Laura is there, but just to also highlight the tobacco WHO Framework Convention on Tobacco Control. We know that the cigarette butts that are used, there's a lot of plastic that's there around that. So it's also, as I said, it's a health and an environmental hazard. So WHO advocates to align with that, and Laura, I will definitely speak more on that. And the other aspect is promoting health equity. It's really, really important as WHO to have the rights of humans. So it has to be a rights-based approach. So we're looking at it as a One Health approach. We do definitely understand that overuse of plastics is impacting the indigenous people in vulnerable communities, including rag pickers. So it is really important for us to highlight this, the promoting of health equity aspects into the treaty, and WHO totally supports this. So I just wanted to highlight some of the key aspects here. Next slide. Maybe we could skip the slide. It's basically, I can just talk about one of the points here. Is not that, WHO would support in terms of norms and standards that are there, but we also want to promote a good balance between health and environment. And the last point here is on transparency and accountability. I think those provisions have to be added in there, which is important regarding potential health risk and harm and guard against, claims of confidentiality in health information. Very often we see that the transparency and accountability is missing in most of the plastic products that we are using. The number of chemicals and polymers that are used. So it's also important to have good labeling and transparency around it. So in terms of, we're aware of what is being used and what is the end use and how it could be disposed of. Next slide. Yeah, I'll just end at this slide. Is basically what are the key actions that we are taking forward as we move to the INC5. We will definitely continue working with the different constituencies and stakeholders that we are working with, the member states, the health sectors, the academia, the non-state actors, including the private sector, the youth constituencies, and everyone. We want to continue with it, continue to having dialogues and webinars. And thank you again for inviting us to the webinar today that we have. And we also, as I said, we're looking at a life cycle approach. So we're doing a workshop that will be on climate resilient, environmental, sustainable health services with focus on plastics and healthcare. So it's about procurement and supply chain aspects, how we can really intervene from the very beginning and increase awareness, including working not only from the headquarters, but the region offices and country offices of WHO, which work again very closely with the member states and the ministries that are there. So yeah, definitely. And we'll keep you updated of all the work that you're doing as WHO here. And again, congratulations on, hosting this webinar, and we totally are aligned with it. And I'm sure, there's hope moving forward. And we know that we're, it's a race against time at the moment with the INC5 coming so close and the treaty language to be negotiated. But we are very hopeful that the language will be strong and advocate both the health and environmental aspects that, we have being advocating as WHO. And so over to you, and thank you so much.
Thank you so much, Dr. Mega, for explaining the ongoing commitment of the WHO in assisting the process of INC itself. And maybe, Doctor, you can share the link that maybe our participants can refer to if they want to delve deeper into WHO commitment work. And yeah, definitely, if anyone also has questions, please don't hesitate to put in the chat box during the session. So I hope that the speakers also can help to answer the questions before we jump into the specific Q&A session. So for now, I think before we jump into the core session of the webinar, I would like to invite everyone to join the documentation session. And if anyone willing to be captured their picture, so you can turn on your camera, we will be having like a quick screenshot as the documentation for our social media publishing, since we have like quite good number for now, and we have all the speakers joining in the same room. So everyone, if you are comfortable, please feel free to open your camera, and my colleague will help to take some screenshot. Stephen, are you there? Okay, I just
Yes, okay. Hi everyone.
Okay.
So please turn on your camera, and if possible, please also use our virtual background that has been sent into the chat. So we have 4 slides, so you never know when your picture is being taken. So please keep your best smile. I see now only the first page that has opened the camera. We still have a lot of names and faces without the actual faces. So we will wait a few seconds more.
You can count down.
Okay. Now I will do the first photo session for the first slide. Okay. 1, 2, 3. Okay. Thank you. Now the second slide. Okay, last photo. So this is your last chance to turn on your camera. 1, 2, 3. Okay, now the third one. Okay, no one, but I will just take it. And now the last slide, no one is here, but it's okay. Thank you so much. Now over to the moderator.
Okay, thank you so much, Stephen, for this quick photo shoot session. All right, thank you so much, everyone who has just turned on your camera and joining our documentation session. So I'm going to move to the next session of our webinar, which we will have 6 amazing speakers that are talking about more deeper how the health impact of the plastic pollutions affecting the vulnerable groups such as children, women, and also the waste pickers. And as you can see here in the fine slides, these are our amazing speakers. We have 6 different speakers with different backgrounds that will again delve deeper into each specific topics. So I will jump into the first speaker. Can you next slide, Stephen? All right, we will have Sonia Buffing. I'm sorry if I mispronounce, misspell the name. Sonia is from IPEN Youth Co-Chair and also Nexus 3 Foundations. So Sonia is an environmental toxicologist with an extensive experience dealing with chemical and hazardous waste issues, including mercury, persistent organic pollutants, lead, asbestos, e-waste, chemical and plastic, including gender and chemical issues. A participatory approach, stakeholder engagement, and systemic change are the main approach of its interventions in addressing environmental and health issues. She is a senior program officer and researcher for Nexus 3 Foundation in Indonesia, as well as IPEN Youth Culture. So, Sonia, are you here?
Yeah, yes.
Okay, cool. So
Okay.
I will just give the floor to Sonia. Stephen can share the screen.
Okay.
All right, thank you.
Okay.
Yeah.
Yeah. Thank you, Fitri, for introducing me. Hello, everyone. Good morning, good afternoon, good evening from Indonesia. I'm Sonia Bustin from Nexus 3 Foundation, represent the IPEN Youth Caucus, and I will share the opportunities and traits under the Plastic Treaty to protect intergenerational health and human rights. Yeah, next slide, please. Yeah, okay. This is the outline of our discussion today. Just in general, we will discuss plastics impact on children's health and the opportunities and traits to address under the plastic treaty and also safeguarding future generations. Yeah, next. Okay, before I start, I imagine everything that may change 20 years from now. So before I start, I want us all to please imagine everything that may change 15, 20 years from now. Current conditions affect our future generation, children, grandchildren, and the subsequent generations. Yeah, this photo is quite interesting. So it's this ancient IPEN colleagues at INC1 in Uruguay illustrated since beginning that the plastic treaty is a treaty that addresses human health and protection issues, especially the vulnerable groups such as the children and women childbearing age and pregnant women. So the plastic pollution poses significant risk to children's health, necessitating urgent action to mitigate its effect. So the data on this slide is just what we all already know. So as an illustration of the seriousness of this issue, I believe that Prof. Andrea will talk in detail about this part. Yeah, next slide, please. Understanding plastic impacts on children's health. Again, we must always remember that children are not little adults. Organ tissue, their bodies are growing and developing. So the plastic can have adverse effect on children's physical health, leading to respiratory issues and hormonal disturbances. And then the psychological implication of plastic pollution on children include increased anxiety and stress due to environmental degradation. Then the social impacts of plastic pollution on children can exacerbate inequalities and hinder their overall well-being. Then furthermore, studies show a strong link between plastic pollution and childhood diseases such as asthma, allergies, and learning disabilities, urging immediate action for mitigation. Yeah. So furthermore, case studies exemplify the severity of the issue, highlighting real-life consequences of plastic exposure on children's health. Next slide. The IPEN has carried out several sampling and analysis related to hazardous chemicals in plastic, especially in plastic children's toys in recent years. Toys made from recycled plastic are toxic to humans, may contribute significantly to daily dioxin intake levels in children who chew their toys. The level of toxic chemicals found throughout the samples studied were comparable to levels found in hazardous waste, such as ash from the waste incinerators. It's very dangerous, and we cannot allow this to continue to happen without any restriction that can protect these children. Another example, IPEN research last year found toxic substances, including chemicals that have been banned globally in toys and other products made with recycled e-waste plastic or the black plastic, purchased from almost 30 countries across Africa, Asia, Europe, and America. Recycling of plastic and toxic chemicals in recycled plastic products are one of the crucial elements to be discussed further at the upcoming INC. You can visit the IPEN website and see the complete reports there. Yep, next slide. The threats to address under the plastic treaty. Here are some of the threats that need to be addressed under the plastic treaty. First, the primary plastic and the toxic plastic chemicals. The volume of plastic produced today is known to harm human health and the environment. They contribute to increasing climate change and cause high emission of micro and nanoplastic. So producing plastic in large quantities also means releasing more toxic chemicals throughout the plastic's life cycle. Without regulatory intervention, plastic production will increase, resulting in increased climate pollution and health problems. So to protect human health and the environment, INC must maintain these provisions and negotiate control measures to manage production the volumes. This provision should refer to both primary and the secondary polymers, which is like the virgin plastic and the recycled plastic, as both cause damage and the overall volume of the plastic produced. It's also important to combine a circular economy approach with a reduction in plastic production, including elimination of toxic plastic chemicals. The next point are promoting a toxic-free circular economy practices that can reduce waste and encourage sustainable resource management, benefiting children's health also. Enhancing monitoring and enforcement mechanism is crucial in ensuring compliance with plastic pollution regulation and safeguarding children's. Then last, incorporating children's health perspective in policy-making processes can lead to more effective and targeted intervention in mitigating the plastic pollution. Next slide. Next is the role of intergenerational health. Some things we need to pay attention to are, first, the adverse effects of plastic exposure can transcend generation, posing risks to the future offspring through genetic mutation and epigenetic change. Then the interconnected health between generation underscores the urgency to address plastic pollution for safeguarding human rights and ensuring a sustainable future for all. The third is the effective regulation under the plastic treaty is vital to prevent intergenerational harm from the plastic pollutants, emphasizing global cooperation and enforcement mechanism for lasting impact. Then the last, protecting intergenerational health involves the holistic strategies that address the root causes of plastic pollution to break the cycle of harm and to protect the rights of present and the future generations. Yeah, next slide. Concerning intergenerational health and the human rights, the action we need to pay consideration are about first linking environmental protection to human rights frameworks, emphasize the right of children to clean and healthy environment, then access to clean air, water, food, and is essential for children's health and well-being. So necessitating robust protection measures. Then ensuring a legacy of health and well-being for future generation requires concerted efforts to mitigate the environment threats like plastic pollution. And last, ethical consideration in protecting children's health from plastic harm underscore the moral imperative to prioritize their well-being in environmental policies. Next slide, please. The plastic treaty aims to address plastic pollution by setting targets and regulation to reduce plastic pollution and waste. Then the objective related to children health protection within the treaty prioritizes safeguarding the well-being for the future generation. Then the treaty holds significance for future generations by promoting sustainable practices and protecting the environment for posterity. And also the implementation challenges and the opportunities exist in the translating the treaty's goal into tangible action to ensure intergenerational health. Yep. Hello. Yep. The next slide, please. Next slide, please. Yeah. We see now that currently many youth figures have become leaders in campaigning for various types of environmental issues. Some things we need to strengthen regarding these include education for the sustainable development, equips children and youth with the knowledge and skills to become advocates for environmental conservation. Then youth lead initiative play a vital role in combating plastic pollution, inspiring collective action and driving positive change. Advocacy for children's right to healthy environment promotes their well-being and ensures their voices are heard in decision-making processes. And the last, encouraging youth participation in decision-making empowers children to contribute to shaping policies that safeguard their health and the environment. Yes, next slides. Okay. Because I only have like 10 minutes, this presentation has underscored that the urgent need to safeguard children's health by addressing the impacts of plastic pollution. A call to action is imperative to protect children from the harmful effects of plastic pollution and secure a healthy future for all. Then collective efforts are essential in combating plastic pollution and ensuring a sustainable and healthy environment for future generations. Let us commit to working towards a plastic-free future where children can thrive and in a safe and clean environment. And the last, effective regulation under a plastic treaty is vital to prevent intergenerational harm from plastic pollutants, emphasizing global cooperation and enforcement mechanism for the lasting impact. That's all from my side. Thank you very much for all your attention. I hope that what I shared earlier can be useful and we can discuss more in the discussion session. Thank you very much.
Thank you so much, Sonia. It was a really inspirational session, like presentation, how the importance for us to recognize the threat of the plastic to the children, even in the toy. Guys, can you imagine that in the toy? So everyone, please flood the chat box with the virtual claps, or you can use the reactions like I did to give appreciations to Sonia presentations. Thank you so much, Sonia, for your session. It was really, really amazing. All right. Great. So we are going to jump into the second speaker. Stephen, could you please help me share the screen? All right. Okay. All right. Thank you so much. So, yep, Sonia just highlighted the importance and for us to recognize how the plastic pollutions, even in the daily life that we don't expect, it will be in the toy, harm the children's health. And now we are going to dig deep into the discussion how in the specific pathway of hormones impacting the health of the humans caused by the plastic pollutions. And this session will be delivered by Dr. Andrea, and as part of the Endocrine Society of IPEN. Dr. Andrea Gore is professor and Fastek Chair in Pharmacology at the University of Texas at Austin, where she investigates the effect of environmental endocrine disrupting chemicals, or EDCs. And Dr. Andrea has published 4 books and over 200 scientific papers, was editor-in-chief of Endocrinology from 2013 until 17, and was lead author of Endocrine Society's 2 scientific segments on EDCs, and on the 2024 Endocrine Society IPEN Guide to EDCs. Without further ado, I will allow Dr. Andrea to take the floor. Thank you.
Yes, thank you so much for inviting me. And I'd also like to thank Sonia for a great lead into my talk. I'm going to be talking in more detail about the health effects that are posed by EDCs and plastics. Next slide. And just in February, a group of us between the Endocrine Society and IPEN published this guide to endocrine disrupting chemicals, threats to human health. And I've just put that into the chat if you're interested in that guide. Next slide. Okay, so we know that there are toxic chemicals in plastics, and my interest, and I think the Endocrine Society and IPEN's interest also, are how some of those plastics can act as endocrine disrupting chemicals, or EDCs. EDCs interfere with hormones and their actions. We need hormones because they're required for the regulation of growth and development, metabolism, stress, reproduction, and many other functions. We need them for our lives. And when these functions are perturbed by EDCs, they lead to a variety of disorders, such as diabetes and obesity, cardiovascular, reproductive, behavioral problems, and even certain cancers. Next. And among those chemicals, the ones that we know the most about are those in the families of bisphenols and phthalates. And they are prevalent in plastics, as I'll show in another slide. The science behind how EDCs in plastics cause these adverse health effects has grown. And we also have a better understanding of how the environment contributes to disease prevalence. Of course, our genetics contribute to our predisposition to get a disease, but it's the environment that really sets the trajectory towards health and disease. And the evidence is incredibly strong. So there is a convergence of research in laboratories looking at effects, testing effects of EDCs in cell lines and animal models, and work from human epidemiology that shows that exposures to bisphenols and phthalates in plastics result in detrimental health outcomes. And this has been supported and acknowledged by numerous scientific and medical organizations around the world. Next. So here's where we mainly get exposed to bisphenols and phthalates. I'm just going to go through these quickly because time is short, but bisphenols can leach through from plastics, from food can linings, from medical and sports equipment, even your eyeglass lenses, thermal paper receipts, water pipes, adhesives, paints, and lacquers. And generally, the biggest concern is when they get into the food chain due to contact or other similar types of exposures. With plastics, the PVC products, personal care products that we can apply to our skin. They can be fillers in medications. You take a drug to be healthy and it may have an EDC in it. Endocrine disrupting chemical is what EDC stands for. Food and beverage packaging, children's toys, as we heard from Sonia, and medical tubing. Next slide. And this is just a short list, I should add. Let me also mention that when we replace chemicals, because in many, for example, in the US, we've replaced bisphenol A with other chemicals. And in the marketplace, you'll see products that are BPA free, but in reality, they've been replaced by probably other members of the bisphenol family that are also likely to be endocrine disrupting chemicals. And so here's a short list of the negative health outcomes that are directly linked to phthalates and bisphenols, directly linked from the animal studies, and correlated with disease from epidemiology studies in humans, brain development and behavior, metabolic problems such as diabetes and obesity, cancers that are usually sensitive to hormones like breast, prostate, ovarian, and endometrial cancers. The thyroid system can be disrupted by phthalates and bisphenols, and the cardiovascular system and hypertension are linked to phthalates and bisphenols. Next. So we've already heard about EDCs in or about plastics threatening vulnerable populations. And I'll go deeper into this by talking about the endocrine disrupting chemicals that are within those plastics. And of course, the timing of exposure is very important. And let me say up front that there is no age of exposure, whether we're a fetus or an infant or an adult or aging, that is not vulnerable. Of course, we are all vulnerable to these EDCs because we have hormones in our bodies throughout our lives that help keep us healthy. But most of the research focus has been on development because that's when the body is changing very rapidly and probably has the highest sensitivity to the hormones in our body and the greatest vulnerability to EDCs. And we know that our fetuses and our children are being exposed through measures of these chemicals in amniotic fluid, umbilical cord, blood, and tissues that will affect these babies. So for the rest of my talk, what I'm going to focus on are what we call the generational or the intergenerational effects alluded to in the previous talk, whereby endocrine disrupting chemicals can affect multiple generations, either directly or indirectly. Next. Okay, so how does this happen? So bear with me because I'm going to talk you through the slide of how when a pregnant woman is exposed to chemicals, her fetus is exposed, as are the cells within the fetus. You can see them as little purple dots in the fetus. And those are meant to represent the cells that will become the sperm or the egg cells for the next generation. We call those the germ cells at that point. They're the precursors to the sperm and the egg cells. So this demonstrates that if a woman is getting exposed to chemicals and plastics from microwaving in plastic or from personal care products or just other environmental exposures, we have this multi-generational exposure. Next slide. And why is this important? This is important because those germ cells that were shown in purple in the previous slide, those little cells within the developing fetus, that become the sperm and the egg and the next generation can get programmed. I call it programming by EDCs, and I'll define that in a second. And if that programming is heritable, it can affect multiple generations. So let me talk a little bit about how that happens. Those germ cells, of course, like all cells in our body, contain DNA, and DNA is the blueprint for the next generation, and DNA is in every cell as the organism develops. But not every piece of DNA is active. So DNA is very highly regulated. And when we talk about programming of germ cells by EDCs, we're not talking about mutations that often people think about with DNA. We're talking about factors that can regulate the DNA and determine that DNA's function. And we call those epigenetic mechanisms. I don't have time to go into how those mechanisms work, but in general, the way they work is by connecting to the DNA in some way and affecting how that DNA is going to be expressed and determine what proteins are made in a cell. If that epigenetic programming is affected, then that can change the DNA in a way that it functions in relationship to health and disease. So next slide. And so we know that exposures to these EDCs and plastics lead to intergenerational negative outcomes. Here are the ones that I think have the strongest evidence linked to phthalates and bisphenols in plastics, and that includes childhood obesity across generations, male and female reproduction, and behavioral effects seen across generations from these epigenetic programming mechanisms. So next slide, which is my last slide, the take-home messages. Plastics are ubiquitous, as are their chemical components, such as phthalates and bisphenols. There is very strong scientific and medical consensus that many of these chemicals are EDCs. Developmental exposure, of course, can change the lifelong trajectory towards health or disease. And we also know that there are these intergenerational exposures associated with reproductive, behavioral, and metabolic problems. I talked about epigenetic mechanisms. If anybody wants to follow up more on the details of the mechanisms, I'd be happy to talk about that later, or you can email me. And replacement chemicals are not the answer. One replacement for another may be just as bad as the previous, and it is critical to find alternatives and test thoroughly before their entry into the marketplace. And with that, I'll end. Apologies, I went a couple minutes long, and look forward to the Q&A session at the end.
Thank you so much, Dr. Andrea. It was a very insightful session, how the plastic pollutions can affect in the molecular level, which we never expect. Like, we always talk about, okay, how it impacts the environment, but on the human health, it's a very, very complex mechanism. And thank you, Dr. Andrea, for highlighting that. And yeah, I just want to invite all of the speakers, feel free to jump into the chat box. If you find any interesting questions you want to answer by chat, that will be very good as well. And okay, so we are going to jump into the third speaker. Today we will have Laura Salgado from the Global Center for Good Governance in Tobacco Control, or GGTC, which will bring one of the examples of the importance of coherency between the policies for plastics, with the example parallel with the instruments on the tobacco control. And Laura Salgado is a Honduran with extensive experience advocating on public health issues, coordinating campaigns, and building coalitions globally. Prior to her work with GGTC, she was the coordinator for the Americas region of the Framework Convention, alliance where she played an important role in mobilizing a multi-sector network for the development of the Framework Convention on tobacco control of FCTC. Also helped ensure that FCTC was represented at the UN high-level meetings on the non-communicable diseases, the Global Action Plan on these NCDs, and the Sustainable Development Goals. Currently, Laura is supporting the plastic treaty negotiations to align its policies with tobacco control. And this will be a very interesting presentation, and I will give the floor to Laura. I'm sorry, you're okay. Yeah.
Yeah, perfect. Thank you so much. Hello, everyone. It's both an honor and a privilege to speak to you today as we are discussing this important topic that we need to address, that is the importance of health in the plastic treaty discussions. I have been working in tobacco control for many years, and being now part of this process of the plastic treaty negotiation is a very interesting and challenging process. Today, I would like to explore how can we integrate a health-centric approach into the plastic treaty process, and I will focus on three key questions. How can the plastic treaty achieve policy coherence with other UN treaties like the WHO FCTC or Tobacco Treaty? Why must the public health community engage in the plastic treaty process? And how can the polluting industry be held accountable for the harms they cause to the health of the people? The plastic treaty should align with the existing UN treaties like the WHO Framework Convention on Tobacco Control, or FCTC, or Tobacco Treaty, to achieve policy coherence. The 10th session of the FCTC, the Conference of the Party, made an important Article 18 decision in February this year, which highlights the environmental harm caused by plastic cigarette filters. It recognized these filters are unnecessary, avoidable, and problematic single-use plastics. The decision urges the parties to consider the environmental impact from the entire life cycle of the tobacco product, including cultivation, manufacture, consumption, and the waste disposal. By integrating this policy into the plastic treaty, we can create a united approach to tackling plastic pollution and its health impact. The executive director of the UNEP reminded the delegates during the first date of the 10th session of the Conference of the Party the significant environmental impact of tobacco and called for a stronger collaboration between the WSFCTC and UNEP. The public health community must engage in the plastic treaty process because plastic pollution has severe health impact, especially on vulnerable groups like children, women, alongside waste speakers and informal workers. By bringing in health perspective, we ensure that the treaty not only aims to reduce environmental damage, but address why ultimately we need to protect public health and promote well-being for community worldwide. This holistic approach is vital for addressing the full spectrum of plastic pollution impact, and the decision from the FCTC Conference on the Party emphasized the need for a comprehensive regulatory options regarding filters in cigarettes and related products to mitigate this health risk. However, we must ensure that those with conflicted interests, like the tobacco industry, do not have a place in policy development. Holding pollutant industry accountable is crucial for mitigating the health impact of plastic pollution. We can impose higher taxes to harm products and enforce stringent regulations. We already have a precedent in applying taxes on tobacco industry. In Ireland and Spain, for example, the government is applying a special tax on tobacco industry to make it paid for the cost to the state in cleanup cigarette butt, which is the single largest leader. The COP10 decision also invites parties to hold the tobacco industry accountable for the environmental damage it causes. Tobacco use poses significant health risks to women, including increased risk in fertility, complications during pregnancy, and various cancers like cervical, breast, and lung cancer. Women are also at higher risk of cardiovascular diseases due to smoking. Additionally, women, particularly in low-income families, often suffer from secondhand smoke exposure, leading to serious health problems. Many women working in growing tobacco are inflicted by the environmental impact of tobacco production, which further exacerbate these issues affecting women's livelihood. Women have a critical role to play in advancing for a strong tobacco control policy, especially at the INC5. The major group of women from UNEP can lead the charge by championing these issues that affect them directly and contributing actively to the policy-making process. The tobacco industry targets children and youth through aggressive marketing tactics, leading to early addiction and severe health risk. Nicotine has a determinant impact of adolescent brain development, affecting memory, attention, and learning. The Global Blues Voices movement is a powerful platform for youth to advocate for change. The Children and Youth Major Group to UNEP recently joined the Youth Declaration adopted by the World No Tobacco Day. Youth can play a vital role in the plastic treaty process by raising awareness, demanding ban on cigarette filters, classify them as a hazardous waste, and holding the pollution industry accountable. It's crucial to reinforce this declaration and champion these issues at the INC5. Informal workers, particularly the waste pickers, are highly vulnerable to the harms of tobacco waste. The 4 trillion cigarette butts discarded annually exacerbate this problem. Every day, they are exposed to toxic plastic from cigarette butts and other tobacco products, putting their health at serious risk. We must call for a ban of these household materials to protect those workers. Policy changes and protective measures are needed to ensure their safety and well-being. In conclusion, achieving policy coherence between the plastic treaty with existing UN treaty like the FCTC, engaging the public health community in plastic treaty process, and holding pollutant industry accountable are crucial steps toward a health-centric approach to addressing plastic pollution. The impact of tobacco on women, youth, and informal workers is profound and multifaceted. We must unite in calling for inclusive existing elements from the FCTC into the plastic treaty when participating in the negotiation process to protect these vulnerable groups. Thank you for your attention, and I look forward for questions and further discussions on the critical issue.
Thank you so much, Flora, for the insights. How the plastic issues are also become a really great concern in the tobacco field, which it will be our collective work also to help supporting each other, like not only limiting from this sector, but also how this also cross-sector work that we need to do together. Thank you so much, Laura, for your insights, and I'm so happy to get this new perspective, how the impact of the plastic pollution is also impacting through the tobacco sector. And moving to the fourth speakers, don't worry, we are coming to the end. That please feel free to put any questions in the chat box, and also the speaker, if you want also to answer, that feel free to do so. And we will be having Michelle Reyes from the Healthcare Without Harm. So this will be another interesting perspective, how the healthcare system can also support the plastic treaty. And Michelle Reyes here will talk about it later. And before that, I will introduce Michelle. Michelle is a registered pharmacist and medical doctor, currently serving as a healthcare waste sustainability officer at the Healthcare Without Harm and a family and community medicine resident at the Medical City Park. In her role, she leads the sustainability team in transforming the health sector by addressing key issues such as procurement, plastics, waste, and chemicals. Michelle has spearheaded several impactful projects, including the TB Innovations Health System Strengthening Project on green and safe health facilities with FHI 360 and the Global Health Versions Initiative, which advocates for a plastic-free planet and the detoxification of the health sector. Michelle earns her medical degree from Far Eastern University Nicanor Reyes Medical Foundation. So without further ado, Michelle, I'll give the floor to you.
Thank you so much for that introduction. Good morning, good afternoon, good evening, everyone. I'm just going to share my slide. Let me know if you can see it clearly.
Yes, we can see that.
Okay. Thank you again. I'm Dr. Michelle Reyes, Sustainability Officer of Healthcare Without Harm, Southeast Asia. And we will focus about the plastics and health and the role of health sector in terms of the International Negotiating Committee or the Global Plastics Treaty and the opportunities and threats. So the plastic pollution is also a One Health problem because of the interconnected impacts on environmental, animal, and human health. And while plastics have emerged as an indispensable part of caring for our patients because they are moldable, lightweight, and durable, it is now clear that plastics are also responsible for significant harms to human health, the economy, and environment. And the problem is growing. With this in mind, we are confronted with the triple planetary crisis, which is all interlinked, such as climate change, pollution, and biodiversity loss. So, linking plastic with climate change, in 2023, plastic production was estimated to contribute 3.7% of greenhouse gases, and unless significant changes are made, we will reach 4.5% of the global total by 2060. So, with that in mind, the surgical masks and PPEs also contribute with carbon dioxide equivalent to 78 coal-fired power plants operating continuously. For pollution, over 16,000 chemicals are used in plastics in their entire life cycle, of which more than 4,200 are chemicals of concern for their persistence, toxicity, mobility, and tendency to bioaccumulate, meaning accumulating in our bodies. And fewer than 1,000 are currently covered by international regulations, and vital hazard data are missing for over 10,000 chemicals. For biodiversity loss, it is estimated that there will be more plastic than fish in the sea by 2050, and approximately 2.4 million tons of waste enters our ocean every year. During the COVID pandemic, medical waste such as gloves and masks was observed harming birds, fish, and other animals. So the current situation and the challenges ahead call for a transformation in the way that we manage our environment with respect to health and well-being. Current approaches have laid the foundations, but they have not proven sufficient for sustainably and efficiently reducing environmental risks to health and building health-supportive and enabling environments. So known avoidable environmental risks cause about 3 out of 10 deaths and disease burden worldwide, and 7 million of them are from air pollution, in which is also linked with plastic and climate change. And with inadequate sanitation, poor hygiene, it can result to more than 800,000 preventable deaths worldwide. So with this, because of the global plastics treaty, we have deemed the plastic pollution as a global health threat. The plastic crisis threatens human health directly and indirectly, and people can be exposed to hazards directly from using plastic products, for example, from chemicals and microplastics in IV bags or bottled water, or indirectly from air pollution and climate change caused by making and burning plastics. So the resource extraction and plastics manufacturing facilities are often sited in or near low-income or otherwise marginalized populations who may suffer pollution and environmental degradation from multiple sources and have limited ability to challenge industrial interests. And air pollution from incineration facilities is known or suspected to cause cancer, reproductive, and birth defects, among other serious health and environmental impacts. And people who depend on the environment that are affected by the plastics crisis, such as the fishers or people involved in tourism, may also suffer due to loss of livelihood. Although there is still a lot we don't know about the risks of plastics, including significant gaps on microplastics and thousands of chemicals used at different stages of the plastics life cycle, many health impacts are already proven, and scientists are uncovering ever more threats as research accelerates. And despite the advertising that stresses the importance of plastics in healthcare, exposure to medical devices and healthcare-related plastics are part of the problem, and they can release chemicals such as phthalates, BPAs, as mentioned a while ago from our previous speakers, or microplastics directly into our body. The newborn, unborn, elderly, and those with chronic or multiple health conditions can be at most risk, and medical professionals can be exposed to plastics on a daily basis through our work. So what are the crucial issues of the plastics from healthcare facilities that need to be addressed in the global plastics treaty? Healthcare consumes around 15 million tons of waste per year. Plus, medical facilities generate non-medical plastics such as single-use plates, drinking bottles, and toiletries. And in most cases, these non-medical plastics outweigh the medical devices. 35 to 40% of all plastics products produced globally are single-use. And according to our report from Healthcare Without Harm, the hospitals in Southeast Asia and other countries have not escaped this problem. So according to our audit, which was conducted in 2018, which was before the pandemic, on average, more than 50% of waste from hospital are plastics. And packaging is almost always single use, and that can account up to a quarter of the plastic waste from hospitals. So the perception that single-use plastics are safer is not supported by evidence. Typically, they are used because they are more convenient. So how can the healthcare sector, what are the role of the health sector in shaping the global plastic treaty, and what are the significant aspects that needs to be highlighted? So in how to build a plastics-free healthcare, during the INC Healthcare Without Harm, developed an open letter from healthcare professionals, which was endorsed by several organizations representing 6 million individual healthcare facilities and healthcare organizations. You can also join our alliance in terms of climate impact and issues such as plastics. We also have toolkits in reducing plastics in healthcare facilities and support the implementation of 12 criteria, which is based on the WHO guidelines. And during the Global Plastics Treaty, we aim to build health champions with a unified messaging, which could be key in influencing the policymakers. And we also did communications workshop and webinars along with key health organizations, aiming to build and advocate for a strong, ambitious, and just global plastics treaty. And this month is actually Plastics Free July, which calls on the health sector and individuals to adopt sustainable practices, detoxify healthcare, and contribute to a healthier, plastics-free future, emphasizing that plastic pollution harms lives and healthcare should not be exempted from the Global Plastics Treaty framework. Here are several of the case studies from our global green and healthy hospitals in which they were able to divert recyclable waste from landfill and had identified segregation as a key to success, and many other case studies from the South Asia and different regions of Healthcare Without Harm. And with this, the Plastics Treaty can set a legally binding goals and deadlines to reduce and detoxify healthcare plastics. This will stimulate manufacturers to phase out older and less well-designed products and prioritize development of new ones when they're needed. It will also provide a level playing field so that innovative products and practices are incentivized and help support the existing momentum for change in the health sector. The chemical industry has highlighted that the medical use of plastics to argue that current plastic production saves lives. Instead, we know that plastic production and disposal is responsible for significant diseases. And we also know that plastic reduction and detoxification in the healthcare is already underway through our different and many healthcare case studies. And with this, there are several health sectors and hospitals have already been shown that the health sector is ready and have been implementing the plastic reduction in the healthcare facility. So with the tagline, first do no harm from healthcare without harm, health is determined not so much by what doctors do for patients, but by arrangement in society. We need to treat people, but we also need to address the issues that make people sick. However, doctors alone cannot only empower communities. There has to be a partnership working with our patients, communities, and different organizations and sectors. The Global Plastics Treaty, which addresses the plastic pollution crisis, is a once-in-a-generation, legally binding treaty everyone, including the health sector, should be engaged in to advance the intergenerational well-being and health against plastic pollution. I think that's my last slide. Thank you so much.
Thank you so much, Michelle, for highlighting how the importance of the health sector also supporting the plastic treaty itself. And this is very amazing work of the Healthcare Without Harm. Thank you so much for your work and contributions to the process as well. It's really inspiring us. And yep, I'm going to jump into the next speaker. So we will have a special guest from International Alliance of Waste Speakers, and we will have Indumati here. I think, yes, she's already in the Zoom. So Indumati from International Alliance of Waste Speakers currently will discuss on how the upcoming plastic treaty needs to be protect informal workers and waste pickers. And for note that in Indumati will needs to have assistance from Dr. Harsita Umes, an amazing medical doctor from India, will help us to translate from Canada to English and from English to Canada if needed. So I will introduce Indumati. Indumati is a dedicated operator of WARD, 150 Dry Waste Collection Center, or DWCC, in Bellandur, Bangalore. Her journey began as a waste sorter at DWCC in 2016, where she swiftly progressed to become an operator. Today, she leads a team of 88 employees across three DWCCs, overseeing the collections and segregation of dry waste over 50,000 households daily, amounting to 3,000 until 5,000 kilograms processed per day. Her advocacy extends internationally as president of Tiaja Shramika Sangha, affiliated with the International Alliance of Waste Pickers. Indumati actively represents waste pickers from the Asia region at the international forums, including the INC, highlighting their contributions on advocating for just transition. So here, I would like to welcome Indumati and also Dr. Harshita Umes. Okay. All right.
ನಮಸ್ತೆ ಎಲ್ಲರಿಗೂ. ನನ್ನ ಹೆಸರು ಇಂದುಮತಿ ಅಂತ. ನಾನು ಫಸ್ಟ್ ವೇಸ್ಟ್ ಪಿಕರ್ ಆಗಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ದೆ. ಇವಾಗ DW ಸೆಂಟರ್ಗೆ ಡೋರ್ ಟು ಡೋರ್ ಕಲೆಕ್ಷನ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಮುಖ್ಯವಾಗಿ ಇದರಲ್ಲಿ ನನಗೆ ಜಾಗ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ನಿಮ್ಗೆ ತುಂಬಾ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳಕ್ ಇಷ್ಟಪಡ್ತೀನಿ. 2 ವಿಷಯದ ಬಗ್ಗೆ ನಾನು ಮಾತಾಡಕ್ ಇಷ್ಟಪಡ್ತೀನಿ. ಒಂದು ವೇಸ್ಟ್ ಪಿಕರ್ ಹೆಲ್ತ್ ಬಗ್ಗೆ, ಇನ್ನೊಂದು ಈ ಪ್ಲಾಸ್ಟಿಕ್ ಟಿಟಿಯಲ್ಲಿ ಏನ್ ಬರಬೇಕು ಅಂತ.
Thank you, everybody. Namaste. My name is Indumati. I used to be an informal waste picker. Now I'm doing door-to-door plastic collection. It's really an honor for me to address you here today, and I would like to speak about 2 main things.
ಏನೇನು ಹೆಲ್ತ್ ಪ್ರಾಬ್ಲಮ್ ವೇಸ್ಟ್ ಪಿಕರ್ಗೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದಾಗ, ಮುಖ್ಯವಾಗಿ ಅಲರ್ಜಿ ತುಂಬಾನೇ ನಮ್ಗೆ ವೇಸ್ಟ್ ಪಿಕರ್ಗೆ ಬರುತ್ತೆ. ಮತ್ತೆ ಇನ್ಫೆಕ್ಷನ್ ಅಂದ್ರೆ ಇನ್ಫೆಕ್ಷನ್ ಆಗೋದು, ಹೊಟ್ಟೆ ಇನ್ಫೆಕ್ಷನ್ ಆಗೋದು, ಯೂರಿನ್ ಇನ್ಫೆಕ್ಷನ್ ಆಗೋದು, ಮತ್ತೆ ಪೈಲ್ಸ್ ಅಂತದು ಬರೋದು, ಈ ತರ ಎಲ್ಲ ನಮ್ಗೆ ವೇಸ್ಟ್ ಪಿಕರ್ಗೆ ತುಂಬಾನೇ ತೊಂದರೆಗಳಾಗುತ್ತೆ.
So when we really speak about like the health effects of what's really happening to waste pickers, we talk mainly about allergies. And after allergies, we talk about infections. Like we have a lot of infections, stomach infections, urinary tract infections, and also piles, which is hemorrhoids.
ಅದ ನಂತರ TB ಆಗಿರ್ಬೋದು, TB ಕಾಯಿಲೆ ಆಗಿರ್ಬೋದು, ಮತ್ತೆ ಇದು ಪೀರಿಯಡ್ ಆದಾಗ ಇನ್ಫೆಕ್ಷನ್ ಜಾಸ್ತಿ ಆಗೋದು. ಯಾಕಂದ್ರೆ ನಾವು ಆ ಟೈಮಲ್ಲಿ ಜಾಸ್ತಿ ಓಡಾಡಿ ಅದನ್ನ ತೆಗೆದು ನಮ್ಗೆ ಅದನ್ನ ಅಂದ್ರೆ ವಾಶ್ರೂಮ್ ಕೂಡ ನಮ್ಗಿರಲ್ಲ. ಪಬ್ಲಿಕ್ ಪ್ಲೇಸ್ ಅಲ್ಲಿ ಮಾಡೋದ್ರಿಂದ ಅದನ್ನೆಲ್ಲ ನಾವು ಅವಾಯ್ಡ್ ಮಾಡಿದಾಗ ಅಂತ ಪ್ರಾಬ್ಲಮ್ಸ್ ಎಲ್ಲ ನಾವ್ ಎದುರಿಸ್ಬೇಕಾಗತ್ತೆ.
So another issue that really affects us is tuberculosis. It's tuberculosis, and I've seen a lot of my fellow colleagues who've suffered from tuberculosis, and this becomes especially challenging for us. Not tuberculosis. In general, one of the things that's very challenging for us is maintaining our health and hygiene, especially when we're menstruating, because we don't really have place for us to. We don't have proper sanitation facilities. And infections are much more during these periods of time. We also have to walk long distances. We don't have easy access to water or other supplies as well. And this makes it extremely challenging when we are menstruating, resulting in a lot of reproductive tract infections and illnesses, sometimes even leading to infertility.
ಅದಕ್ಕಿಂತ ನಾವ್ ಇಂಥದೆಲ್ಲ ಅನುಭವಿಸ್ಬೇಕಾದ್ರೆ ನಮಗೆ ವೇಸ್ಟ್ ಪಿಕರ್ಗೆ ನೀವೆಲ್ಲಾ ಕಡೆ ನೋಡ್ಬೋದು, ರೀಚಾರ್ಜ್ ಮಾಡ್ಬೋದು. ವೇಸ್ಟ್ ಪಿಕರ್ಗೆ ಆಯುಸ್ ಅನ್ನೋದೇ ತುಂಬಾನೇ ಕಡಿಮೆ. ಅಂದ್ರೆ ನೀವು ನೋಡ್ತಾ ಇರ್ಬೋದು, 60 ವರ್ಷಕ್ಕಿಂತ ಹೆಚ್ಚಾಗಿ ವೇಸ್ಟ್ ಪಿಕರ್ ಬದುಕೋದು ತುಂಬಾನೇ ಕಡಿಮೆ ಇದೆ.
So she's getting a little emotional right now because she's saying that we don't live really long. We live only for, you've never seen a waste picker who's more than 60 years old. Most of us die very young at the age of 40 or 50 years old. And it's because we have so many of these infections that happen together, and we don't really get enough treatment that is required for it. And something must be done to protect our health and well-being.
ಬೇರೆ ದಾರಿ ಇಲ್ಲ ನಮ್ಗೆ, ವೇಸ್ಟ್ ಪಿಕ್ ಮಾಡಿನೇ ನಾವು ಜೀವನ ಮಾಡೋಂಥದ್ದು. ಯಾಕಂದ್ರೆ ಪ್ಲಾಸ್ಟಿಕ್ ಅಲ್ಲೇ ನಮಗೆ 60% ಆದಾಯನ ನೋಡಿ ನಾವು ಅದರಲ್ಲೇ ಜೀವನ ಮಾಡೋಂಥವ್ರು. ಬಟ್ ಅದಕ್ಕೆ ನಾವು ಏನ್ ಕೇಳ್ತಾ ಇದೀವಿ ಅಂದ್ರೆ, ಅಟ್ಲೀಸ್ಟ್ ನಮ್ಗೆ ಒಂದು ಹೆಲ್ತ್ಗೋಸ್ಕರ ನಮಗೆ ಒಂದು ಸ್ಪೆಷಲ್ ಆಗಿ ಒಂದು ಹೆಲ್ತ್ ಇನ್ಸೂರೆನ್ಸ್ ಆಗಿರ್ಬೋದು, ಮತ್ತೆ ಎಲ್ಲರಿಗೂ ಪೆನ್ಷನ್ ತರ ಬರುತ್ತೆ. ಬಟ್ ನಮ್ಗೆ ಯಾವುದೇ ರೀತಿ ಇಲ್ಲ. ನಾವು ಅರ್ಧ ಆಯುಸಲ್ಲೇ ನಾವು ಹೋದಾಗ ನಮ್ಮ ಮಕ್ಕಳಿಗೆ ಆಗಿರ್ಬೋದು, ನಮ್ಮ ಫ್ಯಾಮಿಲಿಗೆ ನಾವೇ ದುಡ್ದು ಸಾಕಂತ ಕೆಲವೊಂದು ಫ್ಯಾಮಿಲಿ ವುಮೆನ್ಸೇ ಕೆಲವೊಂದು ವೇಸ್ಟ್ ಪಿಕ್ ಮಾಡಿ ಅವ್ರ ಫ್ಯಾಮಿಲಿಯನ್ನ ಮೇಂಟೈನ್ ಮಾಡ್ತಾ ಇರ್ಬೇಕಾರೆ ಅವರೇ ಹೊಟ್ಟೋದ್ಮೇಲೆ ಆ ಫ್ಯಾಮಿಲಿನ ನೋಡೋಂಥವ್ರೆ ಇರಲ್ಲ. ಬಟ್ ಆದ್ರಿಂದ ಲೈಫ್ ಇನ್ಸೂರೆನ್ಸ್ ಆಗಿರ್ಬೋದು, ಇಲ್ಲ ಅಂದ್ರೆ 60 ವರ್ಷಕ್ಕೆ ಮೇಲ್ಪಟ್ಟು ಅವ್ರು ಬದುಕಿದ್ರು ಕೂಡ ಅವ್ರಿಗೆ ಯಾವುದೇ ರೀತಿ ಕೆಲಸ ಮಾಡಕ್ ಆಗದೇ ಇರೋಂಥ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ಅವ್ರು ಇರ್ತಾರೆ ವೇಸ್ಟ್ ಪಿಕ್ಕರ್. ಅವ್ರಿಗೆ ಪೆನ್ಷನ್ ಬರೋ ತರ ಆಗಿರ್ಬೋದು.
Okay, so what she's saying is we don't really have a choice. We don't do this because we want to do this, but this is the only way that we can lead our lives. And even in all of the money that we're earning, only 60% of that money comes to us. And we're not asking for much. All we're asking is for maybe give us some kind of a health insurance or give us some kind of life insurance, so that when we die, because we know we're going to die young, we come into this knowing that we're going to die young and we don't have a choice. We are the only sole earning members of our family. We're doing this because we need daily bread and butter. We need a house above our heads, and we're only thinking of our children or of our husband who's unable to support us at this point of time. So what happens after I die, or if I'm no longer able to pick up the waste? Because this money that's coming to me, it's something that's coming to me every single day. The next day, if I don't go and I don't this waste, there's nothing for me. I don't have health insurance treated for the incur. I don't have life insurance. If something happens to me, there's nobody who can take care of my children or who can take care of my family. And even if I stop picking, I don't even have a pension in this job. So what am I supposed to do? I don't have a choice. I can't not work, but I also can't stop working. And this is what my life is. So I'm really asking for some kind of an insurance scheme or some kind of pension to help us out.
ಬಟ್ ನಮಗೂ ಅರ್ಥ ಆಗ್ತಾ ಇದೆ ಪ್ಲಾಸ್ಟಿಕ್ ಅಲ್ಲಿ ಎಷ್ಟು ಎಫೆಕ್ಟ್ ಇದೆ, ಎಷ್ಟು ಕೆಮಿಕಲ್ ಇದೆ ಅಂತ. ಬಟ್ ನಾವು ಕೂಡ ಇಷ್ಟ ಪಡ್ತಾ ಇಲ್ಲ ಅಷ್ಟೊಂದು ಕೆಮಿಕಲ್ ಅಲ್ಲಿ ನಾವು ಕೂಡ ಕೆಲಸ ಮಾಡ್ತಿರೋದು ನಮಗೂ ಕೂಡ ಇಷ್ಟ ಇಲ್ಲ. ಬಟ್ ನಮಗೂ ಕೂಡ ಜಸ್ಟ್ ಟ್ರಾನ್ಸಿಷನ್ ಅನ್ನೋದು ಬೇಕು ಅಂತಾನೆ ನಾವು ಕೂಡ ಕೇಳ್ತಾ ಇದೀವಿ. ಬಟ್ ಕೆಮಿಕಲ್ ಅನ್ನ ಕಮ್ಮಿ ಮಾಡ್ಬೇಕು, ಜಾಸ್ತಿ ಇವಾಗ ರಿಯೂಸ್ ಸಿಸ್ಟಮ್ ಅನ್ನ ನಾವು ತರಬೇಕು ಅನ್ನೋದೇ ನಮ್ಮ ಒಂದು ಇದು ಕೂಡ.
So everything that you're speaking about just transition, about the detoxification, the phasing out of chemicals, we completely agree with that. We know firsthand how harmful these are, and we experience it every single day. And we want more recycling, we want more reuse, because we know it's going to be beneficial to us.
ಇನ್ನೊಂದು ಈ ಟಿಟಿಯಲ್ಲಿ ಏನ್ ಬರ್ಬೇಕು ಅಂತ ಕೇಳ್ತಾ ಇದೀವಿ ಅಂತಂದ್ರೆ, ಇವಾಗ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅನ್ನ ಪ್ಲಾಸ್ಟಿಕ್ ಎಲ್ಲೂ ಲೀಕ್ ಆಗ್ದಂಗೆ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಮಾಡ್ಬೇಕು ಅಂದ್ರೆ ಅದಕ್ಕೆ ತಕ್ಕನಂತೆ ಕೆಪಾಸಿಟಿ ಬಿಲ್ಡಿಂಗ್ ಅನ್ನ ಉತ್ಪತ್ತಿ ಮಾಡ್ಬೇಕು.
So what we're really looking for from this plastic treaty, apart from the protection of our health and well-being and insurance or something like that, like a financial compensation, is you have these plastics and these chemicals that are like leaking into the environment. Something must be done to prevent that leakage, from preventing these chemicals from leaking into the environment. And also we need more capacity building on how people can manage this waste, not only for informal workers, but also to other people who are segregating the waste before that or using the waste before that, because it's affecting us at the end.
ಕೆಪಾಸಿಟಿ ಬಿಲ್ಡಿಂಗ್ ಆಗಿರ್ಬೋದು, ಮತ್ತೆ ಫೈನಾನ್ಷಿಯಲ್ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರೆ, ಟೆಕ್ನಾಲಜಿ ಬೇಕಾಗುತ್ತೆ, ತರಬೇತಿ, ಮುಖ್ಯವಾಗಿ ತರಬೇತಿ ನಮಗೆ ಸಿಗ್ಬೇಕು ಅಂತ ನಾವು ಕೂಡ ಕೇಳ್ತಾ ಇದ್ವಿ. ಬಟ್ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಡೆವಲಪ್ಮೆಂಟ್ ಮಾಡ್ಬೇಕು ಅಂತಾನೆ ನಾವು ಕೂಡ ಜಸ್ಟ್ ಟ್ರಾನ್ಸಿಷನ್ ಅಲ್ಲಿ ಕೇಳ್ತಾ ಇದೀವಿ. ಅದ ನಂತರ ಎಷ್ಟೋ ಪ್ಲಾಸ್ಟಿಕ್ ಸಿಂಗಲ್ ಯೂಸ್ ಪ್ಲಾಸ್ಟಿಕ್ ಇಂದ ತುಂಬಾನೇ ತೊಂದರೆಗಳು ಅನುಭವಿಸ್ತಾ ಇದೀವಿ. ಬರೀ ನಾವು ಮನುಷ್ಯರು ಮಾತ್ರ ಅಲ್ಲ, ಕೆಲವೊಂದು ಸಿಂಗಲ್ ಯೂಸ್ ಪ್ಲಾಸ್ಟಿಕ್ ಇಂದ ರೀಸೈಕ್ಲಿಂಗ್ ಆಗಲ್ಲ, ರೀಯೂಸ್ ಮಾಡಕ್ ಆಗಿಲ್ಲ ಅಂದ್ಮೇಲೆ ಅದು ಬೀದಿಗೆ ಬರುತ್ತೆ. ಬೀದಿಯಲ್ಲಿ ಪ್ರಾಣಿಗಳು ಕೂಡ ಅಂದ್ರೆ ಹಸುಗಳು ತಿನ್ನುತ್ತೆ. ಆ ಹಸು ಕರಿಯಂತ ಹಾಲು ಎಷ್ಟು ಮಟ್ಟಕ್ಕೆ ಫೀವರ್ ಇರುತ್ತೆ, ಅದನ್ನ ಮಕ್ಕಳಿಗೆ ನಾವು ಕುಡಿಸ್ತೀವಿ. ಆ ತರ ಎಲ್ಲ ಕೂಡ ಹೆಲ್ತ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ಕೆಲವೊಂದು ಪ್ಲಾಸ್ಟಿಕ್ ನ ನಾವು ಕೂಡ ಸ್ಟಾಪ್ ಮಾಡಿ ಅಂತಾನೆ ನಮಗ್ ಕೂಡ ಬೇಡ ಅಂತಾನೆ ನಾವು ಕೂಡ ಹೇಳ್ತೀವಿ.
So when we really talk about this, okay, one second. So she's saying that we need financial support, but with the financial support, we also need technological support. When you talk about capacity building and everything, you need some kind of technology to come in. Like right now, she's talking with me on a keypad phone and she's logged in with her device. She doesn't have like a laptop or something like that. So that makes it extremely challenging for them to really get in with the times and really understand how things are going on. And we need more support from other organizations, from governments, so on and so forth. And that's what we're calling for in the just transition, that this developmental sector that's being affected by it needs to be included in these dialogues, and it needs to there needs to be something done about single-use plastics, because most of them are not recyclable and not reused. For example, she says that in India there are a lot of cows, we see them on the streets and everything, and they ingest these single-use plastics. And in India we directly, we take the milk from these cows and we feed it to our children. So we see what it happens to our children. We can smell the difference in the milk, we can feel the texture difference in the milk. So we've been calling for this stop, we've been calling for this ban since years together, but like we want this to happen, we're not seeing it happen, and it can't happen fast enough.
ಇಂಟರ್ನ್ಯಾಷನಲ್ ಅಲಯನ್ಸ್ ಆಫ್ ವೇಸ್ಟ್ ಪಿಕರ್ ಅಲ್ಲಿ ಕೂಡ ನಾವು ಕೇಳ್ತಾ ಇರೋದು ಈ ನ್ಯಾಯವಾದ ಪರಿವರ್ತನೆ ಸಿಕ್ಲೇಬೇಕು, ಬದಲಾಗ್ಬೇಕಂತಾನೆ ನಾವು ಕೂಡ ಇದ್ ಮಾಡ್ತಾ ಇದೀವಿ. ನಮ್ಗೆ ಈ ರೂಮ್ ಅಲ್ಲಿ ಮಾತಾಡೋದಕ್ಕೆ ಅವಕಾಶ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ತುಂಬಾ ತುಂಬಾ ಧನ್ಯವಾದಗಳು.
So from the International Alliance of Waste, because we are calling for the protection of the human rights and health of these informal workers. And we thank you so much for introducing us, for having us at this dialogue, and for listening to how it's affecting our everyday lives. I hope I translated everything. I did the best I could.
Thank you so much, Harsita and Indumati, for giving this amazing intervention and giving the insights how the plastic pollution is impacting the waste speakers. And this is so saddening for me as well to hear how the real situation is currently happening. And this highlight and underscore the importance why we need to have this international legally binding instrument of the plastic treaty. Once again, thank you so much, Indumati and Harshita. All right, I'm going to jump into the last speaker. Okay, thank you so much, Stephen. Right, thank you so much. We have Dr. Pruva Prabhapatil. So Dr. Pruva is a young health professional and also a medical doctor, which is a surgeon in training, ophthalmology. Wow, amazing. And she is also a feminist activist based in India. She co-founded the Global Climate and Health Alliance Youth Climate and Health Network and works as a youth advisor to the LSHTM's Children, Cities and Climate Action Lab. She is also the co-moderator of Healthcare Information for All, HIFA, and serves as an editorial member of climatehealth.info, run jointly by the WHO and WMO. Additionally, she has the experience of serving as the regional focal point for youth health focus at the MGCY. Dr. Patil has actively engaged with the INC process, and her advocacy at the INC2 and INC4 was aimed at highlighting the impacts of plastic pollution, emphasizing its dual nature as an environmental and public health issues. So I think this will be a very interesting session, as Dr. Pruva will also try to cover the previous discussions and also bring in how the perspective from young health professional in the lens about the plastic treaty itself. So Dr. Pruva, please, the floor is yours.
Thank you so much. I'm just going to share my presentation. Can someone confirm if they can see my screen?
Yes, but not this slide. Yeah.
How about now?
Okay. Okay. Good.
Okay, perfect. So first and foremost, thank you so much for having me here. It is indeed an honor, and you've put me in a really tough spot to go after Indumati. There is nothing that can top that. And I just want to take a moment to thank everyone for being here and being a part of this discussion. Before I get any further, let me start by briefly talking about health in the INC process so far, as I've understood it, and what my engagement as a health professional in this process has taught me so far. So up until the INC4, the term health was referenced more than 60 times, about 69 times at the start of INC4, if I were to be accurate, in the draft text, in wide-ranging contexts, which were mostly non-consequential. And most parts of the text recognize plastic pollution as a health issue, and there was some debate on the exact wording of these texts. I was physically present at the INC2 and the INC4 and followed the others remotely. Health increasingly grew to be a bigger part of the conversation with each INC. But on the flip side, participation, rather advocacy and lobbying efforts from the health sector continued to remain the same, and that was quite minimal. And out of interactions with several member states, what stood out particularly strongly to me personally is the apparent quote-unquote lack of expertise on health and how critical or not plastics are in the healthcare system. And this lack of expertise seemed to prevent a lot of active discussion and decision-making from member states that represented mostly non-health ministries. At the INC4, one of the provisions that were widely opposed by the health community, as also discussed and brought out by speakers before me, was a blanket exemption of single-use plastics for health use. The general notion and the narrative that's created by various actors and industries is that the health system cannot function without plastics, and therefore health should be entirely removed from any restrictions on single-use plastics that the treaty might impose in the future. Now, as a surgeon in training myself, I fully understand that some parts of the health system would have difficulty in functioning smoothly without plastic, but also as a young person with concern for the environment and as a doctor that cares for public health, I find it impossible to stand by the irrational use of plastic in the healthcare system worldwide. Do we need all the plastic we have in healthcare? Absolutely not. And especially not the non-clinical or non-surgical plastic that's currently in use. And secondly, a blanket exemption would derail efforts in innovation and finding sustainable alternatives, furthering our reliance on single-use plastics within healthcare. Building with that context from INC processes so far, things seem to be moving in the right direction, but very slow. And now turning to the question of what could health professionals do and what are the ways in which perspectives of young health professionals could be integrated in the plastics treaty. First and foremost, INC 5, as we all know, could be our last shot at undoing this damage and fixing things. Some groups have been extremely vocal on how plastics of all kinds saves lives. And for those who were at the INC, you might have seen different sorts of banners and different sorts of advertisements, which were really moving to see and that advocated for the continual use of plastics, which as health professionals is very problematic to see. I would go as far as calling this whole idea a myth. And we need more voices, especially those of trusted health professionals and those that are considered experts from the field, to bust such myths and counter all of these harmful narratives, especially in the lead up to INC 5. Hospitals and healthcare facilities generate very significant plastic waste, as also highlighted by Dr. Mega. It is impossible to ignore the waste that health facilities generate. And a mandate to reduce plastic use within the healthcare sector by promoting, for example, sustainable practices and the use of safer alternatives is critical, and it's life-saving in the long run. So with all of that said, it just simply boils down to the fact that we desperately need health professionals, health experts, young people interested in health to come into these spaces and make it very clear that plastic takes more lives than they save, and to advocate for change in the current discourse of health-related discussions pertaining to this treaty. Now, naturally, you would ask, what about those that cannot make it to the INC 5? First and foremost, my response would be to educate yourself. There are parts of this treaty, especially those not working in health, and this whole discussion about plastics and health that are sort of still ignored despite being so critical. So my first advice would be to educate yourself on the different interlinkages of health and plastics. And you being in this webinar and you being in this discussion itself is step one of that process. Going beyond that, I would really encourage everyone to leverage the power of social media, local capacity building and grassroots campaigns in spreading this kind of awareness. There are groups that are already working in this, for example, the one that you're a part of right now. And as a healthcare professional, my biggest ask from you would be to make plastic pollution the health issue that it really is. It's not only an environmental issue. It's not only a planetary issue. It is very much a health issue. And as young people that are living and will continue to live with the consequences of whatever decisions are made or not made, we aren't really given the choice to not speak up and not act. Especially with something so critical in the works in the background in the lead up to Busan. And we have a long way to go in our advocacy in making sure health is not tokenized to derail progress that this treaty is set out to make, and that this treaty truly recognizes and acts on plastic pollution as a health issue. A lot of our conversation today has also been on recognizing vulnerable groups from health impacts of plastic, and it almost feels futile to go after Indumati and bring these points, but I think I'd take a moment to re-emphasize some of the points that she touched on, which is the elimination of hazardous chemicals. We need interventions that are aimed at reducing and eventually eliminating hazardous chemicals in plastics. And this will not only help curb the direct negative health impacts, but also the ones that we don't have enough understanding of as of now. The second is the formal sector integration for informal workers and protective measures for these vulnerable groups. Just building on the story Indumati shared, for example, something as basic as protective care and ensuring safer working conditions could go a long way. Introducing informal waste pickers as a part of the formal sector. It's a job that people in every country have been doing, yet with no formal recognition. And incentives or interventions to offer social security benefits are critical and still not a very big part of this treaty as we would like it to be. So with a little bit on that, there's also an opportunity to leverage existing international frameworks and uniting advocacy efforts, like, for example, building on what Laura said about the FCTC and the different initiatives and the different guidelines that already exist within the WHO space. We really have to do a bit in ensuring that this treaty aligns with these different international treaties and the standards that have been set by these to provide a more coherent and comprehensive approach to addressing plastic pollution. We don't have to start from zero everywhere. There's already a lot of work that we can learn from and channel into the INC process. The second is also towards incorporating stronger health elements in the treaty. Do I want to make it sound like there's not there's absolutely nothing being done? No. But do we really need to pace up on how fast we're headed in this direction? Yes. We need a lot more stronger language in the treaty when it comes to health. As of now, health has some mentions on being important and plastic pollution affecting health, but not enough for it to be consequential in any way, and that needs to change. The plastics treaty, as we've discussed, is a legally binding treaty, meaning that it has implications that are invariably going to impact every sector that exists, including the health sector. And all the panelists before me have highlighted why and how this treaty impacts human health and well-being and the different facets and components of it across generations, some of which haven't even come to Earth as of now. So without dragging it on too much, I'm just going to close by saying our advocacy efforts so far haven't been nearly enough, and INC 5 and the months in the lead up to it are all we've got to unite our voices to ensure that the health and well-being of our planet and people are at the core of it. Thank you.
Thank you so much, Dr. Prova, and it's really amazing presentation and also inspires us to join more in the advocacy for the plastic treaty itself, and acknowledging that this issue not only belongs to one sector, but it cross-sector that we need to work together to help shape the first international legally binding instrument of the plastic treaty. And again, thank you so much, Dr. Pufa, and I would like to say thank you so much again for all of the speakers that has been concluded the presentations, amazing presentations that we had today with many perspectives. So allow me to jump into the Q&A session. Please, everyone, if you have burning questions, put in the chat box, and also I would like to invite the speakers to help. Like if you want to reply on the chat box, that will be also good. And I see a very interesting questions in the chat box from Bin Lim. In a toxic-free circular economy, how would you advise to get rid of the chemicals that are currently already in the system? So I think this is very interesting because leading to the transition, we need to understand how we can move into more, into the solutions. And maybe I would like to give the floor to Dr. Megha Rati. Dr. Megha, would you like to answer this question?
Yeah, hi, can you hear me?
Yes, we can hear you.
You know, I think it's a really relevant question, how do we address this? Because as a sector per se, we know that, there are a lot of polymers that are used within the health sector and otherwise. So it's so important, as I was saying, that if we can start to address the accountability and transparency of the polymers, essentially, basically, we should step back a little, thinking about where do we want to start. And as we know, not all plastic polymers or all monomers cannot be recycled. So it's really important to identify what goes in the product. Is it, hazardous or non-hazardous? It has the potential to recycle or not, So basically going to some of the speakers that had highlighted later on, the endocrine disruptors and the alternatives that are used, if they're of the same hazard potential, then we need to be really careful. But just to say that, yes, not everything can be recycled. We really need to be careful and mindful of what is going into the process of manufacturing there. Yeah. I think I could, sorry. I'm sorry, there could be some background noise this side because it's not very clear to me.
Is it good already, Dr. Megha?
Yeah, it's okay for me now. Yeah. Okay. Yeah, is that maybe the other speakers could, be potentially answering this as well. I think it'll be good to get from IPEN as well, how some answers to this question. And maybe healthcare without harm.
Sure. Thank you so much, Dr. Megha, for your answer. I would like to invite maybe from IPEN, Dr. Andrea or Sonia, would you like to give response on this question?
Well, I think that Sonia may know more, but I can give a little bit of perspective coming from US that I think obviously this is an international problem, but we also need to try to act locally as far as what the regulatory process is, because in the US, chemicals can get introduced into plastics with an absolute minimum of testing. And then they later prove, after being released on the marketplace, that they're endocrine disrupting chemicals and they're leading to numerous health effects. So, that's kind of the US perspective, is we need to change that regulatory system. Of course, the US needs to participate more robustly in the plastics treaty than it has so far. But I'll stop there.
Thank you. Thank you, Dr. Andrea. Yep, it's very interesting. I would like maybe to invite Michelle. You would like to respond. Yeah, please, Michelle, the floor is yours.
Thank you. So I agree and support Dr. Mega's mentioned, like the transparency and traceability of the chemicals in plastic that we have right now is imperative for us to know and be aware of what are the toxic chemicals in the plastic products, whether it's non-medical or medical, that we are using right now. And I just would like to share one of the problems right now is if we don't have that, the ingredients that we know about the toxic chemicals in the plastics, it's gonna be a problem in the future because currently there are rising technologies such as the waste to energy, in which they are reliant on plastic products. So they're incinerating plastic products to keep these technologies running. So because we don't know what chemicals are in there, so if we burn those plastics, then the significant human health impacts will be multiplied because of the toxic chemicals, the same time the incineration of those plastic products. Healthcare Without Harm has developed a manual, the chemicals of concern to health and environment, which is this is a two-part reference material, and then we also have the chemicals of concern of to the health sector, in which there are several case studies on how the health sector has managed or reduced the plastics in their own healthcare facility. Thank you.
Thank you, Michelle. Thank you so much for your response. Then I'm gonna floor one more questions. Does the recent adopted resolution on the human rights, maybe this is about the clean, safe, clean, healthy, and sustainable environment, have any effects on the INC5 negotiations? So I would like to maybe invite Dr. Kurva, because you have been followed the discussion, and as we know that this resolution has just recently adopted, and do you think it has effect on the negotiation itself?
So sorry, I didn't get the question quite well. So if you could do a recap of the question.
Yeah, so the question is, does the recent adopted resolution on human rights and a clean environment have any effect on the INC5 negotiations?
So my question to this is going to be a little of what the member states are doing. In my knowledge of the process that I followed so far, I do not think there's a direct reference yet. But if you mean to ask in terms of whether there can be potentials to find interlinkages or to use this resolution to lobby for certain language and to lobby for certain changes in the text, that is something that we as civil society can definitely do. And we as civil society can also, I think one of the other questions in the chat was also, so especially for groups that are at the INC and also groups that are not, it's really helpful to reach out to your member states, to reach out to the ministry that's dealing with the anti process in your country and gauge their position, and also to sort of, I wouldn't want to use the word pressure, but pressure is the right word in this context, pressure them into certain language and the addition of certain references, this being one of them. But the second, because this treaty, definitely one of the problems that this treaty has is, despite so much conversation about having a non-siloed approach, there is a lot of resistance in actually breaking those silos down. If I were to be really direct about this. So is there an existing linkage between the resolution and the INC 5 and the treaty at large? In my knowledge, not as of now, but is that something that could be potentially instrumentalized towards the plastics treaty? And could there be more advocacy in that direction? Yes, I hope I've answered your question in some way.
Sorry, I'm muted. Thank you so much, Dr. Purval, for adding this perspective on how the resolutions of the clean, healthy, sustainable environment impacting the INC5 process. And I think I want to invite maybe Sonia, you want to add perspective, because you talk about the children's rights, and we cannot inseparable the children's rights into the rights to a healthy environment as well. So how do you see the process of the INC itself and the integration of the right to a healthy environment during the discussion? Oh, Sonia is not here. Oh, okay. Okay, it's okay. All right. Maybe I just want to add one more questions. I saw a very interesting questions in the chat box. Addressing to Laura, because talking about the tobacco is sometimes used as an alternative to drive away pests, prevent animal infiltration into agricultural land, and etc., specifically among grassroots communities. How can we ensure the safe use of tobacco in purposes crucial for sustenance of these grassroots communities, while taking into consideration the pollution caused by tobacco industry, and also how can we avoid the exploitation of grassroots communities by this industry in their production or marketing process? I saw Laura already explained a bit in the chat box, but maybe Laura, do you want to elaborate a little bit directly?
Thank you, 50, and thank you, Benson, for that interesting questions. That the use is very minimal of this and not in large scale. Tobacco farmers generally still use commercial pesticides on their plants and without much protection. It's something that we still need to work. We have an article that focuses on this to help the farmers to transition to a more healthier products that they can use. So it's something that we need to work more on this and raise awareness about this and help them to look for alternatives, safer alternatives. And I share my email in case we can provide additional information. Thank you.
Thank you so much, Laura. Everyone, you can scroll to the chat box and find there is a Laura contacts there. And maybe if other speakers also willing to share their contacts for further discussion with the participants who are interested to discuss more about it, please feel free. And I would leave one speakers here in Numati, because I think it's really important to elaborate on what Harshita already mentioned in the chat box. I'm really excited to know if Indomati wants to say something elaborating what Harshita already wrote down on the situations, how the discrimination also happening to the waste pickers. Maybe Indomati and Harshita, would you like to say something about it before we close this session?
Yeah, I think Indumati would love to. I'm just asking her to turn on her camera.
Yep, please. I think Indumat is still muted. Okay.
Should be fine now.
ಯಾಕಂದ್ರೆ ಸುಮಾರು ಸಲ ಆ ಒಂದು ಅನುಭವ ಆಗಿದೆ. ಲಾಸ್ಟ್ ಟೈಮ್ ಕೂಡ ನಾನು ಒಂದು ಮಗುಗೆ ನಮ್ಮ ವೇಸ್ಟ್ ಸ್ಪೀಕರ್ ಒಂದು ಮಗುಗೆ ಹೆಲ್ತ್ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದಾಗ ಸಡನ್ಲಿ ಕರ್ಕೊಂಡು ಹೋದಾಗ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮಾಡಕ್ಕೆ 3000 ಆಗುತ್ತೆ ಅಂದಾಗ ನಮ್ಮ ಹತ್ರ ಅಷ್ಟೊಂದು ಹಣ ಇಲ್ಲ ಅಂತ ಅವ್ರು ಹೇಳ್ದಾಗ ಕೆಲವೊಂದು ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬರ್ಕೊಟ್ಟಿದ್ರು. ಅಲ್ಲಿ ಹೋದಾಗ ಅಲ್ಲಿ ಬೆಡ್ ಖಾಲಿ ಇಲ್ಲ, ನೀವು ಇನ್ನೊಂದು ಕಡೆ ಇದಕ್ಕಿಂತ ದೊಡ್ಡ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋಗಿ ಅಂತ. ಬಟ್ ಅಷ್ಟೊಂದು ತಿಳ್ಕನಷ್ಟು ವೇಸ್ಟ್ ಸ್ಪೀಕರ್ ಅಲ್ಲಿ ತಿಳುವಳಿಕೆ ಇರಲ್ಲ ಕೆಲವೊಬ್ರಿಗೆ. ಈ ತರ ಎಲ್ಲ ಅನುಭವ ಸುಮಾರು ಸಲ ಆಗಿದೆ. ಮತ್ತೆ ಲಾಕ್ ಡೌನ್ ಟೈಮ್ ಅಲ್ಲಿ ಕೋವಿಡ್ ಟೈಮ್ ಅಲ್ಲಿ ಅಂತೂ ತುಂಬಾ ಜನ ನಾವು ವೇಸ್ಟ್ ಸ್ಪೀಕರ್ ಸಫರ್ ಆಗಿದ್ದಾರೆ. ಯಾಕಂದ್ರೆ ಆ ಟೈಮ್ ಅಲ್ಲಿ ಬೆಡ್ ಶಾರ್ಟೇಜ್ ಇದೆ, ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳೋದಕ್ಕೆ ತುಂಬಾ ಕಷ್ಟ ಆದಾಗ ಕೆಲವೊಂದು ನಮ್ಮ ROಗಳೇ ವೇಸ್ಟ್ ಸ್ಪೀಕರ್ಗೋಸ್ಕರ ಸಪ್ರೇಟ್ ಆಗಿ ಬೆಡ್ಗಳನ್ನ ಅರೇಂಜ್ ಮಾಡಿದ್ರು, ಟ್ರೀಟ್ಮೆಂಟ್ ಅನ್ನ ಅರೇಂಜ್ ಮಾಡಿದ್ರು. ಆ ಟೈಮ್ ಅಲ್ಲಿ RO ಇಲ್ಲ ಅಂದಿದ್ರೆ ಎಷ್ಟೊಂದು ವೇಸ್ಟ್ ಸ್ಪೀಕರ್ ನಾವು ಕಳ್ಕೋಬೇಕಾಗಿತ್ತು.
Okay. So she cited one very specific example. She said that one of the children's of my colleague was very sick, and we went to a nearby clinic, and they charged us 3,000 rupees, which is about 30 euros. And she said this was too much for us. We couldn't afford it, and we told them that, saying that, "Oh, we're sorry, but can you please cut down the price?" And they said, "If you can't afford it, then go to a government hospital." So they took the patient to the child to the government hospital. And in the government hospital, they said, "Hey, we don't have any beds available, and this child might need more specialized care," and refer them to another hospital. So basically what she said is they keep, referring them from one hospital to another, and they don't really take us seriously, and we don't get treatments during the lockdown, the COVID. Everyone here has spoken so much about how much of waste was generated in the COVID. And she said we were still working, we were still doing all of that work. But when we felt sick, and we know that, during COVID, there's medicine shortage, there's bed shortages, so on and so forth. But when we felt sick and we went to get ourselves admitted, they told us there was nothing available for us. They told us that we can't help you. And it was extremely heartbreaking because we lost a lot of our peers, and we would have lost so many more people. But fortunately, we had some civil society organizations and some regional officers who actually reserved some beds for us, spoke to people for us, and ensured that we got the necessary treatment. But this is just some examples on how we've been discriminated and how we're not able to receive the treatment we need to receive.
Thank you so much, Harshita.
ಇನ್ನೇನಾದ್ರೂ
and
ಹೇಳ್ತೀರಾ ನೀವು?
ಅದಕ್ಕೆ ವೇಸ್ಟ್ ಸ್ಪೀಕರ್ಗೆ ತುಂಬಾ ಮುಖ್ಯವಾಗಿ PPT ತುಂಬಾ ಮುಖ್ಯ. ಅದಂತ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ ನಾನು ಅವಾಗ್ಲೇ ಒಂದು ಹೇಳೋದನ್ನ ಮರ್ತು ಬಿಟ್ಟೆ, ಇವಾಗ ಹೇಳಕ್ ಇಷ್ಟಪಡ್ತೀನಿ. ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲಿ ಕೆಪಾಸಿಟಿ ಬಿಲ್ಡಿಂಗ್ ಮಾತ್ರ ಅಲ್ಲ ಮುಖ್ಯ, ಅದರಲ್ಲಿ ಫೈರ್ ಆಗದೆ ಇದ್ದಂಗೆ, ಅದು ಯಾವುದೇ ಒಂದು ಫೈರ್ ಆಕ್ಸಿಡೆಂಟ್ ಆಗದೆ ಇರಂತೆ ಸೇಫ್ಟಿಯನ್ನು ಕೂಡ ಅದರಲ್ಲಿ ನಿರ್ಮಾಣ ಮಾಡಬೇಕು. ಯಾಕಂದ್ರೆ ಎಷ್ಟೋ ಸಲ ನಾನು ನೋಡಿದೀನಿ ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಲ್ಲೇ ಫೈರ್ಗಳಾಗುತ್ತೆ. ಅದು ಕೂಡ ನಮ್ಮ ಎನ್ವೈರ್ಮೆಂಟ್ಗೆ ಪೊಲ್ಯೂಷನ್, ಪ್ಲಾಸ್ಟಿಕ್ ಪೊಲ್ಯೂಷನ್ ಇದಾಗಿ ಎನ್ವೈರ್ಮೆಂಟ್ ಹಾಳಾಗಕ್ಕೆ ತುಂಬಾ ಚಾನ್ಸಸ್ ಇದೆ. ಅದನ್ನೆಲ್ಲ ತಡೆಗಟ್ಟಬೇಕಾದ್ರೆ ಅದಕ್ಕೆ ತಕ್ಕನಂತೆ ಕೆಪಾಸಿಟಿ ಬಿಲ್ಡಿಂಗ್ ಅಲ್ಲಿ ಕೂಡ ಫೈರ್ ಆಗದೆ ಇರೋಂತ ಸೇಫ್ಟಿ ಎಲ್ಲ ಇಡಬೇಕು ಅಂತ ಕೇಳ್ತೀನಿ.
Okay. Before I translate that, thank you, Akshata, for clarifying. RO means resource organization. My apologies. So she said that I've spoken about capacity building before, but this capacity building should be more all-encompassing. It's not just about waste management, but also the fact that these wastes very often are sources of fire hazards, and there are a lot of fires that happen, and that also releases a lot of chemicals, and it also causes more issues like burns and such. So when we talk about capacity building, we need capacity building on how to maintain our safety. And she said something that I forgot, but is so important, I really want to highlight, and is my take-home message, is the fact that we need protective equipment. And she said that this protective equipment has been shared by civil society organizations and resource organizations, but she's saying that this is something that needs to be mandated by member states or governments or included in the treaty, because it actually prevents a lot of these health issues that they'd be facing and actually protects their well-being. She's talking about some very basic things like gloves and just footwear to wear. Like, I don't think that's too much to ask. And she says that when these fire and stuff, they break out, there's not much, how do I put this? There's no safety regulations in place. And she says that these safety regulations need to be made, especially because single-use plastics contribute a lot to these fire hazards that happen. ಇನ್ನೇನಾದ್ರೂ ಇದೆಯಾ ಹೇಳಂತದ್ದು ನಿಮ್ಗೆ?
ಇನ್ನೇನಿಲ್ಲ.
Okay, she says there's nothing else. Thank you.
Thank you so much, Harsita and Indumati, for giving more clarifications how the real situations that like the justice and then the healthcare access for the waste picker itself not really providing a good like facilitations for those who need it. And it has become our concern together, and I would like to extend my biggest gratitude to all of the speakers, amazing speakers that have been delivered amazing insights, and then enrich our horizons how the plastic treaty we should see not only from one perspective, but it can be in a very diverse perspective. So maybe Stephen, would you like to show the last slide? From these points, I would like to say thank you so much for all of the participants who coming today and then joining it from the very beginning for our discussion. So due to the time restrictions, we were able to explore more in the chat box that the questions has been brought there. But I hope that all of the presentations already give you more comprehensive, and then now motivate us to more be joining the advocacy for the INC process. And please stay tuned in our social media for more updates on the next Railroad to Busan Plastic Action webinar series, because there will be more webinars coming. And also stay tuned in our website. I've been put the website link in our chat box for you to update for the presentations that we will upload later. And also in the YouTube channel, we will upload also the video that we have today. All right. So thank you so much, everyone, for coming today. All of the speakers, thank you so much. I'm really grateful to have all of you here. And I hope all of the participants also can take a positive key takeaways after this. And yep, I would like to close the session webinar today. Thank you so much, and have a good rest of the day, everyone. Thank you. Thank you, Laura. Thank you, Harsita. Thank you, Indumati. Thank you, Sonia. Thank you, Dr. Andrea. Thank you, Dr.
Well done. Well done.
Thank you, Michelle. Yeah.